have a patient who lives in Puerto Vallarta.
Really?
And she had, unfortunately, a surgical misadventure.
Surgery down there?
Yeah. So let's take a look.
Ooh. Man, that's necrosis after a facelift. Is that even fixable?
So the question is there a way to minimize those scars? You notice I use the word minimize.
Set the expectation.
Yeah, there is no removal.
My neck looks like I just walked out of a fire. My neck is mangled. The pigmentation has been lost, so it's very white. I am ashamed. I'm embarrassed about what I've done to myself for vanity.
Hi, Chica, how are you?
Hi, how are you?
Great, great.
I got your drink.
Oh, awesome.
Yeah.
Your hats are getting bigger and bigger. They're gonna swallow you up if you get any bigger.
Do you like this?
I like it, but it's big.
How does my neck look, by the way?
Well, you've got it plastered with sunscreen.
Good, because I don't want these scars to see the sun.
Right.
At all. I went to a highly rated plastic surgeon. I had a deep plane facelift. A regular facelift, they just pull the skin, and with the deep plane, it's the muscles and the skin that they pull back, and that's the reason that it lasts longer. Within days, my face was swollen and red, and my incision lines were blistering. My surgeon told me that there was nothing to worry about, but when pus started seeping out of my wounds, I knew it was time to worry. Remember when we used to go to San Pancho mountain biking? We'd stop in Sayulita,
Do some paddleboarding.
paddleboard out to the point, come back, and then have drinks and lunch.
And call it a day.
And that was our day. Because I live in Mexico, the sun shines almost every day. I have to cake sunblock on. I put makeup that has sunblock on. The sun actually makes the scars worse because the skin around the scars where the pigmentation is gets darker and it makes it more noticeable. I've always been very active with paddleboarding, mountain biking, jogging. Now if I jog before the sun comes up. You cannot get sun on your scars.
Nice to meet you.
Nice to meet you.
You still live in Puerto Vallarta now?
Yeah.
You live there too?
Yes.
I know it well. I love
you?
it. It's gorgeous. The weather's always good.
There's always something to do.
Always something to do, yeah. Well, you felt comfortable enough to have surgery there, obviously.
I've had several there.
Oh, I got to hear about this.
My good plastic surgeon for the last 5 years has been telling me you don't need a facelift. Wait, just wait. But in my impulsive decision making, I cheated on my plastic surgeon, the good one, because I found a doctor who did this deep plane facelift. I decided to go with this guy and convinced Deborah, my neighbor, and another person. So there were 4 of us that did this.
Really? How much was the facelift?
It was about 8.
8. He had a deep plane facelift on him, okay? How much does your guy normally charge a person for a deep plane facelift in New York?
Now?
Now.
About 300.
$300,000.
What?
Now. Wow. I charge for a deep plane facelift about 75.
Oh my God.
You paid $8,000.
A deep plane facelift is technically more difficult to perform than a regular SMAS facelift. There's also higher risks because you're around all the facial nerves. This is a facelift that you don't want to get a bargain for. Okay, so you have your surgery and it goes okay. Mm-hmm. Your first symptoms, what are they?
I saw a lot of bruising and there was a big black spot. And I said, is this skin necrosis? And he said, it's partial skin necrosis.
Right.
Well,
Okay.
Do you have partial or do you have it if you have it?
Yeah.
You have it.
Yeah.
I mean, eventually I assume it turned black.
Scabs all up and down.
So you had the same facelift the next day? You
No
didn't have
problems at all.
I didn't have any of that.
Yeah, you look
problem.
great.
So it turned black, and then what happened?
One morning I was washing and I was pushing on it to dry and pus came out. And I'm like, there's an infection.
Yeah.
And he was telling me the whole time I didn't need to be on an antibiotic after the week.
You said you were washing it with what?
Just
Soap and water.
Yeah, just soap.
Water from the sink?
Normally it's good, but during the time that we were healing, remember I had the septic tank problem?
Septic tank problem?
I had a
So
problem.
you had some poo-poo in the septic tank water?
No, I didn't know that at the time.
That infection probably came on from the E. coli from the water.
I know that now.
So what happened?
Back to the good doctor, and right away, he was poker-faced, and he just said, I don't know who did this, and I don't want to know. He took a surgical knife and right away scraped it off. It was raw, but I couldn't feel anything. I'm still numb.
Yeah.
But it started healing right away.
You suffered from what we call delay in diagnosis and treatment.
If the doctor would have seen her and treated her the appropriate way, these scars would not be as bad. Joanna had poopy water, and she had a poopy doctor, as a matter of fact.
Must have been an emotional roller coaster afterwards.
She knows.
I know.
Tell us a little bit about that.
I've seen her upset, cry, get angry, and there's nothing we can really do about it.
So, came to us for exactly what?
To see if there's something that could be done and the scar could be less noticeable than the scars I have now. That would be the best outcome for me.
Right. At the end of the day, it's a question of what % improvement is possible.
Hi.
Hello. Let's put your hair back so we can really get a good look at everything. We're going to start with the right side.
Okay.
Okay, so this is just the basic scar. Go ahead and feel that.
Yeah.
I don't like that. Yeah. Yeah.
Let me just want to see this right here.
Honey, you can put it right.
Yeah, but the problem you do that. Yeah, I'm saying doing this, though, is going to expose it more. My biggest concern with Joanna is that her skin is pretty tight. Can I excise some of those scars and make them look great? That's going to be the big question. And the only way I'm going to find that out is by cutting out a scar and trying it on the table. Okay, so I marked out the whole scar. God willing, we can remove that. Now the other side, just turn this way. Let's just say that for one. Let's just look. That's the one that bothers you the most, right?
On this side?
Yeah.
Yeah.
That bothers you the most. And then this, I assume this one here, secondarily.
Secondarily.
So here's what we're talking about doing. Going to the operating room, starting with conservative incisions and then what we call undermine the tissue. Lift it up and see what can we remove first. And then taking stitches and closing it in 2 layers. 2 layers means we're putting one on the deeper layer. That's going to hopefully prevent it from pulling apart as much. Followed by micropigmentation.
The tattooing?
Yeah, or the tattooing, yeah.
Okay.
Now, what's the negative of this? It stretches back out.
Because it's too tight?
Yes. So what do you think?
I know that I'm dealing with the best of the best.
And when we try.
I think she'd be happy with anything than what she has now.
Do you want to do this?
I do.
Good morning, how are you?
Good morning.
What is going to make this case successful or not is going to be the laxity of skin, which means how much stretch do we have with the skin. We just don't know for sure until we're actually operating and in there. For Joanna's surgery today, I will make incisions down the middle of the scars and undermine the tissue. Next, I will lift the surrounding tissue to assess the skin laxity and then pull it together and cut out the excess skin, removing as much of the scars as possible. Finally, I will use 2 layers of sutures to close and lessen the tension on the wound. After she heals, we'll perform medical tattoos, hopefully leaving Joanna with much less noticeable scarring on both sides of her neck. Table up. Okay, we're starting. So we're going to go in and we're going to cut right in the middle of this. But I'm going to go a little bit more on this side. Cutting. You know, obviously, if we could have just cut out and stitched it, we'd be done.
Yeah, the pedal.
But this is kind of a little bit of a safer way to go. I'm going to cut in the middle of the scar, lift up the surrounding tissue, see if I can pull it together, overlap it, cut out those edges of excess skin, stitch it back up, and see if I get rid of the scar. That way, I don't burn any bridges. This is all still scar, right?
Yeah.
Right here too, just a little bit. Okay. So we've undermined the tissue around the scar. So we're gonna see how we can pull the skin together. That thing really pops open. Jesus. Let me just see here.
Use this one, Yeah, easy.
It's gonna be tight. I'm trying to close up this scar on Joanna's neck, but there's so much tension. I'm scared that I'm gonna make it worse. Okay, ready? All right, Paul.
Checking.
Are you pulling?
Yeah.
I gotta tell you, there's still some tension on this wound here. Get a pickup in your other hands and hold that for me for a minute. So we're using the scar to soften or lessen some of the tension. Then we're gonna go to the other side. Luckily, as I undermine Joanna's tissue and pull everything together, I'm able to remove most of the scar. Other side, turn it. 15 blade. Push the skin up. Hold it right there. All right, get that skin out of the way. Okay, hold on. Oh, yeah. See what I just did there?
Yeah, I like it.
I like this.
That looks good.
Thank you guys, Don. I'm really happy because I feel like there is tension, by the way, on the wound. So don't get me wrong. She did not have a lot of laxity, but after she heals, permanent tattoo, that's the goal. Well, hello.
Hi.
How are you?
Good.
So you know Ruth? Ruth,
Hi.
lovely.
Very nice to meet you.
She is going to take care of our tattooing.
It has been 6 weeks since my surgery. The healing process was a breeze. The scars flattened and healed very quickly. Oh, there we go. Oh my God.
That looks great, doesn't it?
Today I'm here to get a neck tattoo, which is something I never thought I would ever say.
If you can get as much hypopigmentation as possible, go for it. I'm going to sneak out of your way. I'm going to let you get started.
Okay, let's clean all the makeup.
This will be great.
When I'm cleaning my skin, it just feels so much better.
Oh, the texture?
Yes, from where you cut the scars out.
We love hearing that.
Yes.
Okay.
My future looks pretty bright. About 6 months ago, it wasn't looking so bright, but now it's just full of opportunities.
Live a little, live it up. Yeah.
Being able to do activities again is just so freeing.
I wanna be stronger. Let out my roar and tell the world that I'm wiser.
Good job. How was it out there?
It was
Very fun.
nice.
Yeah.
It's so good to be back out there
Yeah,
again.
she finally is paddleboarding again.
You look like you're having a blast.
Yeah, and she almost fell too.
No.
You're a little rusty.
It's been over a year, so.
Yeah.
Before my surgery with Dr. Nassif, the deep plane facelift that I had destroyed my neck and my life. I had huge scars up and down both sides of my neck from the skin necrosis. In my consultation, Dr. Nassif said that he might be able to get 50% of the scarring out. He exceeded my expectations. He got way more than 50%, more like 80% of the scarring out, and the medical tattooing has improved the look of my skin, and I just feel very confident and beautiful again. It feels so good to not have the sunscreen caked on and the makeup caked on over
Your big hat, that's embarrassing. To other people.
You know what? That big hat kind of grew on me.
Yeah.
Yeah.
I think Joanna just looks amazing after the surgery with Dr. Dubrow and Dr. Nassif.
It's just so great to see her back with color on her neck and also in her personality. So now that you have officially gotten a tattoo, which you had told me you would never get, when's our matching tattoo gonna happen? Can I schedule it like for next week?
Mother-daughter tattoo.
Oh, you want me to
right
get a
here.
big snake or something?
Yeah, no, we
going
can get
around my
matching
neck?
snakes.